mentorship, active participation, and support, we have crossed 25th century in 5 years, as well as 900 plus in last 365 days. So thank you for supporting IRES Ayush Samriddhi International Webinar Conference Series. I am really grateful to Madam Kamini Dhimanji. Kamini Dhimanji is the personality who has mesmerized, and really she is coordinating, she is helping, she is supporting two webinar series. Number one, infertility series on every Thursday, and woman wellness series on every Saturday. So please do join, subscribe our channel, IRES Ayush Samriddhi, and participate daily, because we are conducting daily 3 webinars during those days in which I am traveling. Just for sake of example, I am in Delhi. So one webinar of long duration is planned only. Thank you, Madam Kamini ji. Thank you very much. And today I would like to welcome Dr. Rajni ji. Rajni ji is from Associate Professor, Department of PTSR, Sri Sri College of Ayurvedic Sciences and Research, Bengaluru. Welcome, madam. Welcome on the platform for first time, I hope. So please do join every Thursday and Saturday. Definitely gynecology and obstetrics. Otherwise, please join, subscribe our channel and share these clips to interested persons. So without wasting much time, I would like to welcome all the experts of the dais, because this is the only platform where all audience are also expert. So I welcome all of them, including our pillar Nishant Shuklaji from Jamnagar, and YouTube viewers who will watch this episode at their convenience. Thank you very much again. I would like to request Professor Kamini Dhimanji to take over the charge of coordination and guide us. You are really inspiring, madam. You are really inspiring. Welcome.
Namaskar, Pawan sir,
Hari Om.
Nishanji, all the experts over the platform, all the audience, practitioners, students, welcome to you all. Our today's topic is integrative approach of the treatment of female infertility. Nowadays, we are living in modern era. In this era, integration is the need of the day. So, how we can integrate the technology, how we can integrate the methodology, how we integrate the research, as well as the treatment of the patients of infertility. So today we are having the speaker, Dr. Rajni, as told that she is from Bangalore. She has done MD in Prasuti Tantra and Stri Roga, and she is having very good experience in the treatment of female infertility. So we have invited her to discuss the topic. We will listen her, and then we will have discussion and then question answer session. So over to you, Dr. Rajni. You can share the screen, and then we will have discussion with you on the
Thank
topic.
You,
yeah.
Thank you, sir. Good evening, everyone. So today my topic is integrative approach in treatment of infertility. So these are my contents of the presentation. So coming to the introduction. So female is given utmost importance because of her ability to bring a new life into this world. That's why she is termed as Janani. But if sometimes, because of some reasons, if she is unable to produce a child, then she is blamed as Vandhya. So Acharya Kashyapa says that Tatra Dvayo Dampatyo Swabhavat Swakarma Parinamantva Prajabhir Buddhir Bhavati Tav Dhanyo Ato Anyata Vishakjitavyo. So if any couple by Swabhava, if they are able to conceive, but naturally if they are able to conceive, they are well praised. But if they are unable to conceive, am I audible?
Yes, yes, audible.
Okay. There's some glitch here. Okay. So they're saying, if a couple is able to conceive naturally, then they are praised. If they are unable to conceive, then they are blamed. So such people who are unable to conceive should be treated. That is what Acharya Kashyapa is saying. Then according to WHO, around 17.5% of the adult population, roughly 1 in 6 worldwide, experience infertility, showing the urgent need to increase access to affordable, high quality fertility care for those who are in need. Millions of people face catastrophic healthcare costs after seeking treatment for infertility, making this a major equity issue and all too often a medical poverty trap for those who are affected. So what is the need of the hour? It's an integrated approach. We need solutions from Ayurveda. We need to understand infertility through the lens of Ayurveda, and so that we can treat it better. So today's PPT is aiming in understanding the female infertility. So coming to the Stri Vandyatva, you have Vandya Nashtartavam Vidyat. A woman who is unable to conceive, in whom the Artava has been destroyed, is considered as Vandya. And according to Charaka Samhita, there are different types of Vandyatva. That is Vandya, Apraja, Sapraja. Vandya is, she is unable to conceive and it is Asadhya condition. Apraja is a condition where she is not able to conceive and it is also correlated with Asraja. Sapraja is a condition where she conceived once but unable to conceive the subsequent pregnancies. So Apraja can be correlated to primary infertility and Sapraja can be correlated to secondary infertility. So Harita Samhita says there are different types of Vandyatva like Kaka Vandya, Anapatya, Garbhasravi, Mritavatsa, Balakshaya, and Garbhakosha Bhanga and Dhatukshaya. So Kaka Vandya, these are different types according to Acharya Harita. We'll see one by one in the coming slides. Then according to Rasaratna Samuchaya also they have told Adi Vandya, then different doshaja varieties they have told, and Abhicharaja, and Vanda Kalpadruma is telling again different types like Tripakshi, Trimukhi, Vyaktini, Vyagrini, like that different types have been told, but detailed explanation is not there. We only follow Charaka's variety and Harita's variety, and we will see that. So coming to the factors responsible for conception, for Garbha Utpatti, we need these factors like Garbha Sambhava Samagri, that is Ritu, Kshetra, Ambu, Bija, Anila, Manasika Bhava, Ahara, Vihara, and Daiva. Ritu is the fertile factor, Kshetra is the Garbhashya, Ambu is the nourishing factor, Bija is Artava and Shukra, then Anila is the proper functioning of the Vata, and then Manasika factor, the calm and peaceful state of mind is responsible for conception, and also proper Ahara and proper Vihara, Patyahara, Patyavihara is needed. Apart from all this, there is one more factor which is governing called Daiva, unknown factor or superpower, or we could say that sometimes it is superpower and sometimes it could be Purujama Greta Punya Papa Karma. All that is coming under this concept Daiva. So everything is normal, but sometimes the couple will not be able to conceive. So unexplained infertility comes under this factor Daiva. Then coming to the factors which are actually causing Stri Vandhyatva are Yoni Pradoshat, Manaso Abhitapat, Shukra Asrak, Ahara Vihara Doshat, Akala Yogat, So we will see this one by one. So first, let us discuss the essential factors for conception. We have already understood Ritu, Kshetra, Ambu, Bija. So any defect in these 4 factors and other factors which I have discussed will also lead to infertility. All these factors, healthiness should be very important. Then coming to Vandyatva Nidana, we'll see one by one. Yoni Pradosha. So what is Yoni Pradosha? Yoni Pradosha includes different conditions like Yoni Vyapat. So if a lady is afflicted by Yoni Vyapat, then as a complication, what happens? She won't be able to conceive. Acharya said, "Na shukram dharayati." She won't be able to conceive. One thing, or hold the sperm, or able to conceive, and tasmat garbham na grihnati. So in that case, she will be left as infertile. So that is the complications of yoni vyapat. And along with that, she will also have different types of disorders. Again, having different types of disorders will prevent her from conception. So that is from yoni vyapat. And again, in under Yodi Pradosha, we can also see that Artava Shrota Vidha Lakshanas. Like, so if the Artava Shrotas is had any trauma, then the lady will suffer from Vandhyatva, that is infertility, Maithuna Sahishnatva, that is dyspareunia, Artavanasha, could be anovulation, could be amenorrhea. So all these are again leading to infertility. So this is Artava Shrota Vidha Lakshana. And then coming to other conditions under that is Yoni Arsha. If the lady is having any kind of arshas in the yoni pradesha, could be cervical polyp, could be vaginal polyp, could be extra growth in the apatya marga, then what happens? Acharya said, yonim upagnanti artavam cha, it will destroy the yoni and the artavas. So if artava is destroyed, definitely again she will not be able to conceive. Then the next one more condition Acharya is saying is bhaga sankocha. So here bhaga sankocha, so it is said that ajata rajasam sriyam kriyate ati maidunam. If sexual activity happens in a female of young age, then in her there could be bhaga sankocha, that the narrowing of the introitus can happen, or any trauma to the introitus can happen, which would lead to bandhya, infertility, or garbhamna grihnati, she won't be able to conceive. And also if she, and otherwise she'll be kashtena bhavati rama garbhavati. So with difficulty she will conceive. So these are the direct references from our classics. Then moving on to the other condition called spalita mutratva, is a condition where at the time of intercourse there will be dribbling of urine. So that is also a reason for anapatya karakam. So she won't be able to conceive. And the next condition is utshipta yoni, that is the displacement of the yoni. Then also it is leading to anapatya karakam. So these are all coming under yoni pradoshad. Apart from this, if the lady is having any other yoni kanda and all, or any other firanga rogas, then also this will lead to infertility. So this is one word yoni pradosha can be understood under various conditions. Then moving on to manaso abhitapa, here samanasyam garbhadharananam, the stable and peaceful state of mind is very, very important for a lady to conceive. If there is stress, then she will not be able to conceive. So it is affecting its PO axis and directly hampering the ovulation. So maintaining the stable mind is very important. Then coming to the Shukra Dushti, so it is said in Shukra Dushti, the ultimate effect is prajotpadani na samardho bhavati. The couple will not be able to conceive. Same goes for Asrik dosha also. If Ashtartha Dushtis are present, then abhijam bhavati. That means there is no ovulation. So if there is no ovulation, definitely there could not be any conception. So that is how we are interpreting this Nidana. And then apart from that, Acharyas have also told Ahara Vihara dosha. So that in that we can include Ashana doshas like Annashana, Adhyashanas, Vishamashana, Viruddha Bhojana, all that can be coming under Ashana doshas. Currently, junk food, all this is coming. And then Vegadharana is also one factor. And if a lady is not following Rajaswalacharya, then also if she is using any apadravyas, and if at the time of coitus the Shukra falls on Samirana Nadi, then also she will not be able to conceive. And if the coital activity is done in the Nyubja and Parshva Sthiti, then also the conception will not happen. So Acharyas are emphasizing on proper diet and proper lifestyle, and also proper coital activity and techniques. So if it is not proper altogether, it will lead to hindrance in the conception. Then Akala Yoga, that is untimely coitus. So one is not following the Rutukala, that is a fertile time. And also if one age is too young or too old, then also there will be a problem. And then also again they're saying Shubha, Shubhadina, Nakshatra Thidi. If this is not followed and it is done in Varjita Kala, Maithuna is done in Varjita Kala, then also that will affect the fertility and conception. Then apart from this, there is also Bija Dosha. So whatever part is affected, that particular organ will be defected. So during the intrauterine life. So that is also very important. If mother's Garbhini Paricharya or mother's lifestyle is very important for her daughter to have a healthy life ahead or a reproductive life ahead. So Bija dosha is that. Then Atma dosha could be Purva Janma Krita, Papa Karma, or any Papas or any Shapas related, that also can come under Atma dosha. And then Jata Harini, these are some conditions of Graha, wherein Pushpagni, Andagni, Durdhara, Kalaratri, Nakini, and Vashya, these conditions, the conception will not happen. And apart from this, Daiva is there, unknown causes. There some supreme entity which is governing this, and this is decided based on Purvajanma Krita, Punya or Papa Karma. So these are all the different nidanas according to the shloka, and I have tried decoding that under different conditions. And then coming to the Anya Nidana. Apart from this, there are also other conditions like Atibalam, Ativrutta. Previously, I have seen the Vaya. So if Atibala, Ativrutta, so too young, too old age, that is after 35 years or something, then the conception, the quality of the ovum will be reducing. So that is what they're saying. And then Ati Ashita, the one Atik Shudita, Ati Pipasita. So these conditions also, conception will not happen. Bhita, Vimana, Maitunecha, Atikama, or Akama also, and Dirgharogini, Anya Vikaropasrishtam. In all these conditions, Na Garbham Datte, the lady will not conceive. Even though if she conceives, then the Garbha will die in the Kukshi. Maybe she will land up in any miscarriage or any IUD. That is what Acharyas are saying, and these conditions should be avoided also. So these are all compiled nidanas for Stri Vandyatva. So coming to Sadhya, Sadhyata, Asadhya varieties are Vandyata, Charkapta Vandhya, and then Vasya Jataharini, Yapya are Nakya Jataharini, Nakini Jataharini, Sadhya are Apraja, Sapraja, then Pushpagni, Andagni, Durdhara, Kalaratri, all these varieties are Sadhya and it can be treated. So this is all about the Ayurvedic understanding of the Nidanas. Moving on to the modern aspect, infertility. Infertility is defined as a failure to conceive within one or more years of regular unprotected coitus. So it is again of two types. One is primary infertility and secondary infertility. Primary infertility denotes those patients who never conceived, and secondary infertility denotes previous pregnancy but failure to conceive subsequent pregnancy. So primary infertility can be correlated to apraja and secondary infertility can be correlated to sapraja. So here they're saying 80% conceive within 1 year of having regular intercourse with adequate frequency 4 to 5 times per week, and 10% will conceive at the end of second year and 10% remain infertile. So this 10% are the one we are treating. And so immediately after marriage till 1 year, if they are not conceived, we should not treat them. We should wait. We should counsel them. And then if at the end of second year or something, if still they are not able to conceive with some pathologies, then only we have to treat them. So this is a understanding here. So moving to so there are different steps, series of steps which are involved for the normal spontaneous reproduction. It's a complex process and it needs some healthy condition of some factors. That is when then the conception will happen. So first thing they're saying is hypothalamus, pituitary and ovary. So HPO axis should be properly functioning so that the ovum is developed or the arthava is properly developed. Menstruation is happening properly, ovulation is happening properly, one thing. Then endometrial lining preparation should be adequate. So endometrium should be healthy enough so that if the lady conceives, the embryo is well implanted. So receptivity of embryo, endometrium and the healthiness of endometrium is very important. And the next is ovulation. If the ovulation is there, then only conception will happen. And though ovulation happened, but the fallopian tubes are unable to capture the egg, the suck the egg, then also there will be a problem. So the proper motility of fallopian tubes are very important. And then at ampullary part, there will be fertilization. So that ciliary movement inside the fallopian tube is very necessary. And then once the fertilization happened, that zygote should go into the uterine cavity. The transport should happen. Transport of the fertilized egg should happen. That also is the responsibility of fallopian tube. The proper peristalsis of fallopian tube only will help this to go and get into the uterine cavity. Once it enters into the uterine cavity, the embryo should get implanted. For that, again, endometrial lining should be well, and the zona pellucida which is there around should get disintegrated. Then only this will be able to go and get implanted. So these are all the necessary areas which are very important for conception and proper growth and development of the embryo. At any junction, if there is any problem, that will be a causative factor for infertility. So let us see the causative factors for infertility. So there are female causes, there are male causes, there are combined, and there are unexplained. So infertility affects both men and women equally. So generally female are the ones who are always blamed and they are always coming for checkup and all, but it is true that both are equally affected and both should be tested, not just female. So let us see the female factors today. So coming to the physiological conditions, conception will not happen before puberty, during pregnancy, during lactation, and after menopause. These are all physiological conditions wherein there is no ovulation, there is no menstruation, and there is no HPO axis functioning that time. So conception naturally will not happen. But there are, in the rare cases they might happen, but as a general rule, during these conditions, conception will not happen. So coming on to the actual causes of female infertility, there are tubal and peritoneal factors, ovulatory factor, and endometriosis. These are contributing to the major causes of female infertility. That is tubal and peritoneal 25 to 35, ovulatory 30 to 40, majority is ovulatory, and then endometriosis is 1 to 10%. So let's see one by one. The ovarian factors. The ovarian factors is anovulation or oligoovulation. So there is no ovulation, or there is, or every month she is not ovulating, every 1 or 2 months she is ovulating. So like that, so anovulation is happening. Generally, this is associated with PCOS. The females who are suffering with polycystic ovarian disease or syndrome, in such girls, the anovulation is happening. And then decreased ovarian reserve. So ovarian reserve is the AMH values are low, then also conception will be difficult. And then luteal phase defect. So luteal phase should be of 14 days. In some girls, the luteal phase will be shortened. So because of which the conception will, though conception happened, the implantation will not happen, or early miscarriages will happen. And next one is luteinized unruptured follicle, where the follicle will be luteinized early before it is getting ruptured. You can see this picture here where this ovulation is not happening and it is getting luteinized. So these are the ovarian factors, dysfunction in the ovary. And then moving on to the tubal factors, there could be some obstruction inside the tube or outside the tube. So sometimes there are pelvic infections which are ascending from the vagina. From the vagina, it can go to the tube and tube might get affected there. So because of that infection, there could be salpingitis, inflammation in the fallopian tube, because of which there could be discharge. And because of those discharges, there could be blockage in the tube. So there could be peritubal adhesions inside and outside. And because of the inflammation, there could be endosalpingeal damage. The layer of the tube could be damaged. Again, if the tubal layer is damaged, then definitely the ciliary movement is hampered. So that is one reason. And then sometimes there could be polyps inside the tube. Sometimes there could be endometriosis. The endometrial patch will be there, again leading to adhesions. So, or sometimes there could be spasm. There is no block at all, but there could be some spasm because of which the tubal lumen is narrowed. So these are all the different tubal factors causing infertility. And another problem with tubal factors is, though once we treat it, if the lady conceives, there are high chances of ectopic pregnancy because the tube is already damaged. Then moving on to the peritoneal factors, there could be adhesions, peritubal adhesions. Then sometimes endometriosis can be there, and because of this, deep dyspareunia is also a problem because inflammation is there in the peritoneal area, pelvic area. Then coming to the uterine factors, these are the factors responsible for hindering the nidation. It will prevent the implantation. Okay, so first one is uterine hypoplasia, that is the uterus is not developed properly, one thing. Second is inadequate secretory endometrium. The endometrium is not receptive, then also implantation will be hindering. And sometimes there could be masses inside the uterine cavity, that is the fibroids could be there or polyps could be there. So that also will affect the implantation. And then endometritis. Sometimes there will be inflammation of the endometrium because of tuberculosis infection. And also sometimes there could be synechia, that is adhesion, that is the walls will be attached to each other, or no, in between the bands will be formed like this. The adhesions can be there, that is uterine synechia. This happens because of DNCs. Those who undergo vigorous DNCs or traumatic DNCs, then this adhesions will be formed, that is synechia will happen. And then sometimes there could be congenital malformation of the uterus, like uterus didelphys, uterus septate uterus, or unicornuate uterus. In this also, this could be another reason for causing infertility. Then moving on to the cervical factors, there are two types in this, anatomic and physiologic. So in anatomic, we see that the cervix will be unduly elongated. Especially this happens congenitally sometimes, and this could happen because of prolapse also sometimes. So that also will prevent the sperm transfer. And acute retroverted uterus, also a reason. And if this os is pinhole, very narrow, you could see this picture here, the narrow pinhole os is also a reason. And the polyps on the cervix, like arches, could be a reason for hindrance in conception. And then physiologically, the cervix is secreting. It has a lot of glands and it keeps secreting. So there will be scanty mucus or sometimes excessive discharges from the cervix, or purulent discharges might be seen. And sometimes there could be anti-sperm antibodies and sperm immobilizing antibodies, which will prevent the sperm to swim up or ascend up into the uterine cavity. So these are all the reasons coming under cervical factors. Coming to vaginal factors, sometimes the vagina is not developed. Atresia of vagina partially or completely does not develop. Or sometimes there could be transverse vaginal septum, or there could be septate, in between there could be septate vagina, or the introitus itself is very narrow, because of which the lady is facing dyspareunia. And sometimes there could be vaginitis inflammation and also different vaginal discharges like candidiasis, bacterial vaginosis, trichomoniasis, etc. Infections are there, because of which there is painful coitus, one thing, and second thing, it is also ascending upwards. So these are all the different causes of infertility, female infertility according to modern. Now moving on to the investigations, here the integration part comes. So definitely we have to take both Ayurvedic Nidanas in mind and also see the modern Nidanas, and we have to investigate thoroughly so that we could identify the proper, what is actual condition, so that we can plan for the treatment. So here, investigations, what are we doing? So after 1 year of regular unprotected coitus, if the lady is not conceiving, then we have to start investigating, not immediately after marriage. Suppose the lady, but this is not the case. If the lady is above 35 years, immediately after 6 months of marriage, we can start investigating this female. And if a male is above 40 years, then we can start after 6 months of marriage, we can start the investigation. But otherwise, less than 30 years of age or 35 years of age, whoever the couple are, till 1 year, we need not evaluate if they are healthy. And if they don't have any pre-existing conditions, we can counsel them and promote for natural conception. If it is not happening, then after 1 year, then we can suggest them for investigations. So why do we do investigations? To detect the causative factors, etiological factors like I've mentioned, which part of this organ is involved, like is it ovarian factor or is it tubal factor, like that. And then to rectify the abnormality in an attempt to improve fertility, because if you know only, then only we can treat that, right? So we have to identify and rectify, and also to give assurance with explanation to the couple if no abnormality detected. Suppose everything is normal, still they are not able to conceive. So that goes into unexplained infertility, and we have to counsel them and we have to plan further. So coming to the evaluation, how do? We take thorough history, thorough examination and investigations. And then this chart I have made, but I will talk individually. So basic investigations we have to go as blood routine, urine routine, thyroid profile, then serology, all this we have to go. And then coming to the individual conditions, what tests we have to do. So first one is for ovarian factor. We have to see, first of all, whether this lady is ovulating or not. So to check that, there are direct methods and indirect methods to check. So indirect methods is, so mid-cycle, the lady will be having sometimes pain or spotting or discharge will be seen. So that can be elicited. But again, the patient has to do that. So it can be a false positive results. And apart from that, patient also can check for basal body temperature. So after half cycle, mid-cycle, it will raise. So that biphasic pattern of that will be there. I will show you the picture. So this is the graph and there will be biphasic pattern. We have to give this chart to the patient and she has to note the temperature every day. And apart from that we also can go for cervical mucus study, because at the time of ovulation, the consistency of the mucus or the discharge will change. Like I am showing in this picture, when it is taken in between two fingers, it can be stretched. The elasticity is there. Or it can be placed in between two slides and it can be stretched. The more it is stretching, that indicates the ovulation has happened and the progesterone effect. And then apart from that, one can go for cytology, vaginal cytology, because vaginal changes are also happening during different phases of menstrual cycle. And also to check, you can also check for hormones like progesterone, estradiol, LH, FSH and all can be checked. And then apart from this, the next endometrial biopsy also can be done and sonography also. Before endometrial biopsy, one have to go for ultrasonography. And then after ultrasonography, biopsy can be done. So in the proliferative phase and also in the secretory phase. So if you have done in the secretory phase, there should be ideally secretory changes. If there are no secretory changes, we have understood that there has no ovulation. And directly, we can check through laparoscopy. If indirect methods sometimes are not confirmative, so directly we can go and check through laparoscopy. And conclusive is pregnancy. If the lady has conceived, then that is a confirmation that she has ovulated. So PCOD, in PCOD, we can go for ultrasonography with other investigations, hormonal tests. And then luteal phase defect and luteinized anruptial follicle also we can go for hormonal tests. And even premature ovarian failure, we can go for AMH. So these are for ovarian factors. Then coming to the tubal and peritoneal factors, one can go for dilatation and insufflation. That is to see if the tubes are patent or not. One can inject the air into it and see, or one can inject the dye, that is hysterosalpingography. The commonly practiced one is hysterosalpingography to see if the tubes are patent or not, if the dye is spilling or not. So this is a picture for hysterosalpingography. And then sometimes if there are any polyps or any masses inside the uterine cavity, then sonohysterosalpingography is done. And then otherwise laparoscopy and chromovertebration is done, phaloscopy. But commonly practiced one is HSG and sonohysterosalpingography. HSG is for tubal patency and sonohysterosalpingography is for any polyps or any masses inside the uterine cavity. So these are all the tests for tubal and peritoneal factors. And then coming to the uterine factors, one can go for USG and then HSG, endometrial biopsy, hysteroscopy, and then laparoscopy. And commonly we usually do is ultrasonography. And then also we go for endometrial biopsy via PPL. Coming to the cervical and vaginal factors. So postcoital test and Sims-Hunter test is told, but which is not practiced currently. And then SCMCT and SCMPT, that is sperm cervical mucus penetration test and contact test can be done to see if the sperm is able to penetrate and move properly. So that can be done. And also one can check for anti-sperm antibodies. And apart from this, one can go for vaginal smear and pap smear. Vaginal smear to understand infections, and pap smear to understand any cervical changes, any pre-malignant lesions are present or not. One can go with pap smear. So these are all the investigations done for cervical and vaginal factors. Then coming to I have not mentioned endocrinological factors before in female conditions because it comes together. So here for endocrinal factors, one can go for hormonal tests like thyroid profile, FSH, LH, prolactin, insulin, testosterone, progesterone, AMH. All this can be done for understanding hormonal imbalance, thyroid dysfunction, and hypoprolactinemia, and ovarian reserve. So moving on to the management, modern management. So how it is dealt, the model. So infertile couples. So first they will categorize those with single defect in one of the partner, those with multiple defects in one or both the partners, or unapparent defect or unexplained loss. Like that, the couple will be categorized and accordingly the treatment will be planned. So couple instructions generally are given are assurance first, and then counseling and assurance is given, and they'll explain how this course of treatment will be and what will be the effect of this. All that will be explained. And then patient is told to reduce or maintain the body weight under normal BMI. And then if there is any smoking and alcohol habits, that is told to be avoided or stopped. And then if there are any coital problems, that could be corrected with counseling and proper guidance. So moving on to the management in modern. So they have conservative management, surgical management, assisted reproductive techniques, surrogacy and adoption. We'll see one by one. So conservative management, whatever condition is there, for example, PCOS is there. So treat PCOS by giving in the model, like they give OCPs and they give for ovulation induction, they'll be giving clomiphene citrate, letrozole, and then HCG injection, all this will be given like that. Based on the condition, the medicines will be given and or sometimes hormonal pills will be given. If thyroid dysfunction is there, thyroid medicines will be given. So like that. If there is any hyperprolactin condition or too much of prolactin in the body, then cabergoline is given. So like that, condition-wise, the medicines are given. That is the conservative management. So in PCOS, they said clomiphene citrate, metformin, FSH, GnRH agonist, antagonists are given. And in luteal phase defect, clomiphene citrate, HCG, progesterone is given. And then LUF, HCG, and bromocriptine is given. In tuberculosis, anti-tubercular therapy and chemotherapy is given. In endometriosis, combined estrogen, progesterone, OCPs are given generally. And then danazole is given, but danazole is not currently practiced now. In cervical factor, if there is any infection, antibiotics are given. And also, if there is less discharge or scanty discharge in the near the cervical area, then estrogen creams are given or oral estrogen tablets are given. And then if there is anti-sperm antibodies, steroids are given. And then if there is any HIV and VDRL positive, antiretroviral therapy are given. So like this, based on the conditions, the medical management will be done. So the whatever the cause, that cause will be treated. Then moving on to the surgical aspect. So surgical management, if there is in ovarian factors, if there is PCOD, there one goes for laparoscopic ovarial drilling or wedge resection. The ovary will be punctured different places so that the ovulation can happen, or there will be wedge resection. There will be some part of the ovary, they will cut it off so that much hormonal secretion burden will be reduced. So this is done as a treatment for PCOD, for ovarian factor. And then coming for the tubal factor, if there is an infected tube, they'll cut off that infected part and then they will do the tuboplasty. That can be done. If cervical factors, if there is an elongated cervix, then amputation of that excessive part will be done and it will be joined back. So that elongated part will be removed. This is a cervical factor surgery. And then if there are fibroids, then myomectomy will be done. And if there is any congenital anomalies, like if there is any septum or something, then metroplasty will be done. Reconstructive surgery will be done. Or the septal removal will be done. Then if there is endometriosis, if there is any endometriotic patch, then laser vaporization will be done and that particular patch will be burnt and removed. if there are uterine syncytia, adhesions inside the uterine cavity, then hysteroscopic adhesiolysis will be done. That is, with the help of hysteroscope, they will break off all the adhesions inside, and then they'll place an IUCD, intrauterine contraceptive device, Mirena. And then if there is narrow introitus, that is the vaginal orifice is very narrow, because of which the sexual intercourse is not happening or dyspareunia is present, then Fenton's operation is done to widen that introitus. That can be done. Then if there are any endometrial polyps, then hysteroscopic polypectomy, that polyp will be removed. If the lady is suffering from obesity, then bariatric surgery can be done. So these are all different treatment options told for treating the causative factors of infertility. Then if this, in spite of conservative management, in spite of surgical management, still if the couple is not able to conceive, then they will go for assisted reproductive techniques or artificial techniques, that is IUI. So intrauterine insemination, that is injecting the sperms into the uterus. Wherein suppose there is any couple is having, the husband is having erectile dysfunction, or the female is having dyspareunia or narrow introitus, then IUI can be preferred. Then IVF and embryo transfer is done. The sperm and ovum are collected and fertilized in the laboratory, and subsequent embryo transferred into the uterus. So commonly it is done nowadays, IVF and in vitro fertilization and embryo transfer. Then ZIFT, zygote intrafallopian transfer, is done. They place the zygote directly into the fallopian tubes. GIFT is gamete intrafallopian transfer, placing the GIFT is the zygote, the fertilized one, whereas ZIFT is the zygote, GIFT is unfertilized. Oocyte and sperm are kept there and they're allowed to fertilize. So that is there. And intracytoplasmic sperm injection, that is ICSI, the sperm is injected directly into the healthy egg. The healthy sperm is injected into the healthy egg, and also the extra embryos are cryopreserved, and later when needed they'll be doing embryo transfer. So indications of ART are tubal disease, if there is tube is not healthy, and if there is any male factor infertility, if there is endometriosis, if there is premature ovarian failure where the reserve itself is less, and in severe cases of PCOS and immunological conditions and unexplained the ART will be chosen. And if the couple is more than 35 years, or they're crossing more age, like 38, 40, like that, then they will not wait for natural conception. They will directly go for assisted reproductive techniques. And even this, before going for IVF and all, first the ovulation induction has to be done, and then all that preparation will be done, and then only IVF and all will be done. So I have shown this in this slide here. So first is ovarian stimulation, and once the ovarian stimulation is done, then oocyte maturation is done, and then they will collect this oocyte and they assess, and also collect the sperms, and then together they'll put it in the petri dish, and they will allow them for fertilization. And then once the zygote or embryo is formed, that embryo is transferred into the female. So this is all is IVF and embryo transfer. So and there are some problems with ART, there could be some risks also. So when we are doing ovulation induction, what can happen? There could be hyperstimulation. Not only one ovum will come, there could be multiple triggering of the follicles can happen. So ovarian hyperstimulation can happen and multiple ovumes can come, one thing. And then pregnancy loss. This is an artificial one, no? This is not happening naturally. So at any time, there could be pregnancy loss, there could be miscarriage or complications if after implantation. And there are chances of multiple gestation, because they will not transfer only one embryo. They'll put 2 to 3 embryos, thinking that only one will survive, others might not survive. Sometimes all of them will survive, and it will lead to multiple gestation. And then mood disorders during pregnancy can happen. There could be difficult labor. Most of them land up in cesarean birth, because it's a precious pregnancy, and they will not take risk, so they go for cesarean birth. And post delivery, they are prone for postpartum depression and early parenting difficulties, and the babies will be with of low birth weight and birth defects sometimes. And then if ART also fails, then there are other options in ART to prevent birth defects. There will be pre-implantation genetic diagnosis. So they'll be analyzing these cells from that embryo and see if they're healthy, and then only they will transfer. So that is currently used to prevent birth defects. And apart from that, there is third-party reproduction, that is donor gametes or embryo donation is also there. So if all this fails, then there is surrogacy, that is this embryo is transferred to the other lady. So she'll be like a gestational carrier, carries the other people's oocyte and sperm, or traditional surrogate inseminated with male partner's sperm. So the surrogacy is there. If this also is not possible, the last one is adoption. So these are the different treatment modalities adopted for treating infertility. So now let's move on to the Ayurvedic aspect. How can we manage this fertility? So we have understood what modern is doing. So most of the time there are complications, there are failures, and success rate is 50-50. Some are okay, but some are not. So at that time, maybe in people in whom the natural conception is completely impossible, such people, we can aid them by giving Ayurveda, so that the quality ovum and quality sperm comes, so that that pregnancy is fruitful. That is one thing. Or through Ayurveda also we can help the couple to plan for natural conception. So let's see that what Ayurveda says about managing this infertility. So chikitsa can be, so Trivida chikitsa is there, that is Yukti Vipashraya, Sattva-Vajaya and Davi Vipashraya chikitsa. These three treatment modalities are playing a crucial role in handling the infertility patients. So let's see one by one. Yukti Vipashraya. So in Yukti Vipashraya, the first thing is Nidana Parivarchana. And then because Yoni Pradosha is one important factor, so Yoni Vyapa Chikitsa can be adopted. Apart from that, Panchakarma can be done, Sthanika Chikitsa can be done, Shamana Aushadhi, all this can be adopted in Yukti Vipashraya Chikitsa. And one more very important and unique concept we have is Garbhadana Samskara and Pumsavana Samskara. So Garbhadana Samskara can be done as I will talk more about it in the discussion. And Pumsavana, we are not talking about Putra Prapti, but we are talking for Garbha Grahanartham. According to Dalana, Pumsavana is done for Garbha Grahanardham, Garbha Sthapanardham, and Putrava Putri Prapti. So here we are doing for Garbha Grahanardham and Garbha Sthapanardham. So all these treatment modalities can be adopted under Yukti Vipashraya Chikitsa. Then, so in Yukti Vipashraya, like first we will see Shamana, Shodhana Chikitsa, that is Vamana, Virechana, Basti, all that we will see. So Vamana is indicated in Kledajanya disorders. So Vikruta Dosha Niraharana can be done. So remove Shrota Avrodha, and it is helpful in normal functioning of Apanavayu, and because of which Artavavaha Shrotas is regulated and proper ovulation is happening, and then the lady will be able to conceive. Basically, this is more effective in Kaphaja related disorders and Kleda and in Staulia, and also in PCOS. This is very, very effective. So I have quoted few articles where theses have been done or case studies have been done for each one. So for Vamana, I have quoted one article. Moving on to the Virechana, Acharya Kashyapa is telling that, of course, Vikruta Pitta is removed. So this is indicated in Garbhashya Gata Vyadhis, and it will do both Indriya Shuddhi and Dhatu Shuddhi. So if the Indriya Shuddhi is happening, definitely Saumanasya is happening. So Saumanasya is very important for Garbhadana. And then because of Dhatu Shuddhi, the Bija is becoming Karmaka. Bijam Bhavati Karmakam. The ovum, the quality of sperm and ovum is getting enhanced. So ultimately, the conception Garbhadana is happening. So this is the benefit of doing Virechana, and direct reference is there in class 6. So I have quoted one more article for Virechana Karma case study. Then moving on to the Basti. So Basti is said as Prashasta. It is the best treatment because Apana Vayu, Apana Sthana, and then local treatment, it is very effective. And all the female Artava Shrotas and female reproductive organs are present in the Apana Pradesha. So that's why it is Prashasta. It does Yoni Prasadana And then it is very useful in cases where Garbhasransante Jatavana Drudasuta. In case of repeated miscarriages or low birth weight babies, such cases, previous history, it is very helpful. And it is said Yapana Basti is Vandhyanamapi Putratam. Even lady is facing difficulty, the lady will conceive with Yapana Bastis. And Anvasana Basti is very much useful in Alpa Bija, Nashta Pushpa, Nashta Bija, Akarma Rai Bija. Here we can take it as like anovulation, oligovulation, and then amenorrhea, oligomenorrhea, like that. These conditions we can take. Anuvasana Basti is very much useful. So one article I have quoted wherein Yapana Basti effect is shown in Srimandhapa. And in Basti, we have Uttara Basti. So doing Uttara Basti, so many research articles have been done, thesis have been done on Uttara Basti. So what does this Uttara Basti do? It will, if there is any adhesions inside or if there is any obstruction inside, it will remove that. It will also help in changing the pH, or it will help in absorption of the drug better, because so this is a similar technique as HSG. HSG dye they are injecting, and with after HSG, patients conceived naturally. That is what some articles say that. So instead of injecting dye, when we are injecting this medicated Grita or medicated Thaila or medicated Kashaya, definitely it is acting on the endometrium, receptivity is getting improved, it is acting on the ovary, the hormonal secretions are improved, and also on the cervix and the vagina. The overall effect is seen in that particular area, making the lady to conceive. So this is the benefit of Uttara Basti, and also I've added one case report for that. Then moving on to the Nasya Karma. Nasya Karma can be done for anovulatory cycles, and also as a Pumsavana can be done for Garbha Grahanartham. So again, it is acting on the Shiras, and definitely it is acting on the HPO axis and regulating the hormonal secretion and maintaining the ovulation and menstruation. So that is that. And then Murdni Taila. So again, infertility, though various factors are present, stress is the main cause for infertility. Or the couples who have infertility as a problem, they go through a lot of stress. So this stress could be a lot of hindrance in their natural conception. So there, Murdni Taila, like Shirodhara, Shiro Abhyanga, Shiro Pichu, Shiro Basti comes into picture, where it reduces the stress and gives relaxation, and also acts on the limbic system and HPO axis, and helping the normal function of the reproductive system. So along with that, Snehana, Bahya Svedana and all can be done, like Abhyanga can be done with the Shirodhara and all, so that it is also relieving the stress. So apart from this, we also have the unique treatment modality called Sthanika Chikitsa, wherein we do Abhyanga, Parsheka, Dhupana, Pichu, Kalka, and Varti in Yoni Pradesha. This is very well effective in cervical factors and vaginal factors. If the hostility of the mucus there, then this is very much useful. So in infectious conditions, it is useful to treat different infections on the vaginal canal and the cervix. So, and also it will strengthen the local area by some people who have dyspareunia, vaginismus, by doing local abhyanga, by doing parisheka and pichu, will relax that area. And those who have lax area also, it gets strengthened. So this is the benefit of Sthanika Chikitsa. And sometimes we need not do big treatments, only with simple Sthanika Chikitsas also patients conceive with other when other factors are normal. Because vagina is filled with blood supply, rich in blood supply, the absorption is better when it is placed. And if it is retained for a long time, that 3 hours, the drug absorption is better. So that will be useful in treating the infertility. So coming to the Shamanaushadis, there are different Shamanaushadis mentioned, like Grita, Taila, Churna, Gutika, Kwata, etc. Classically they are told, but practically we use Putranjiva, Shivalingi, Shatapushpa, Shatavari, then Jyotishmati, then Ashwagandha. Like that, different drugs are there. Single drug preparations also can, single Ekamulika Prayoga also can be used, or compound combined preparations also can be used for different treatment modalities, or as such Shamanaushadis. But again, this is decided based on the dosha and Agni Bala of the patient. Then that is all about the Yukti Vyapashya Chikitsa. Now let's move on to the Sattva Vachaya Chikitsa and Daiva Vyapashya Chikitsa, because we have Daiva as a factor, and we also have Purvajanma Krita Punya and Papa Karma as a cause for infertility. So definitely we need a Daiva Vyapashya and Sattva Vachaya Chikitsa here. And this is very well working in the couples who are facing a lot of stress, and also couples who are having unexplained infertility. This is giving good results. So under Sattva Vajaya Chikitsa, we have assurance and counseling, and proper education regarding reproduction, mode of life, eating habits, and de-addiction can be told. And one can advise Dinacharya, Ritucharya, Sadvritta, and Rajaswala Paricharya. Rajaswala Paricharya, everything cannot be followed in Rajaswala Paricharya, but those which can be done practically, can be adopted in day-to-day life. So like resting during periods, or using the darbha mats with their mattresses. So such things can be adopted. Eating light food, or being calm, not being too much of active that time, that is playing and aerobics and all are avoided. Such things can be adopted in Rajaswala Paricharya. That can be advised to the patient. And also to release stress, one can practice pranayama, yoga, and dhyana. Again, that will bring out the samanasyam. And then coming to Daiva Vyapashya Chikitsa, so direct reference is that Putreshri Yagya has been told. Mantras like Somah Pavana, Vishnu Yoni, etc. Mantras are there. Apart from this, there are various mantras like Santan Gopala mantra, Hanuman Chalisa. These are all very much indicated in Vandhyatva. And also Upavasa has been told, Manidharana has been told. Manidharana under Revati Kalpadhyaya, where Jataharani has been explained, Varanabandha has been told. And apart from that, Lakshmana, Putranjiva can be made in the form of money, and that can be worn. And also little medical astrology also plays important role. So like they say that Shukra is for health and strength of the ovaries, ovum, and the uterus. So positioning of that, and also Guru is responsible for childbearing. So one can look into this medical astrology aspects also when treating chronic cases of infertility. So this is Sattva Vajaya and Daiva Vyapashya Chikitsa one can adopt. And then coming to the Pathya and Apatya. So Pathyas are, so Patya Ahara direct references are there. So Lashuna is Patya and it is indicated in Vandhyatva. And then they said Kshira is Garbhadanakaram. So it is aiding in conception and Vandhyatva Nashakam. And then apart from that, some vegetables have been told, that is Vandya Kotaki Mula. Here I have shown. And then Langali. But Langali is an abortifacient which is not used, but Acharyas have mentioned. Then Katutumbi, Devadali, Vibruhati. So these two are gods, two different gods, and two Bruhatis, blue color and white color, and then Suryavalli, and then Bhiruka. So these are all different food items or which can be consumed. Apart from that, Acharyas have told Mamsa. Mamsa is also Retavardhana and Vandhyana, Vandhya and Garbhadanakara. So these are Patya Aharas directly mentioned in the classics. Apart from that, Patya Vihara, they are saying Nirmalyam Malya Vastram cha Yatasyat Ritusangamaha. So the lady who has conceived, her used clothes or used water can be used, which is not practically possible. Maybe they told because of the pheromones which are present there, maybe that's why. And then Ritusangama, sexual activity at the fertile time. And then these are the Patya Viharas they are saying. Then coming to more about Ahara, then Kshira, Grita, Tila, Masha, Guda, Kushmanda, Bija, Shatavari, Madhu, Lashuna, Palandu, Ajamoda, Jiraka, etc. can be told in the form of Ahara. And then Vihara, Maithuna during fertile period, and regular exercises being metabolically active. So that is also a good one. Then coming to the Apatya, so Acharyas have mentioned Kachura, Surana, and Amla Kanjiga are contraindicated. And then Vidahi, any Vidahi Ahara and Tikshna Ahara should be avoided. That is what Acharyas have told. And again, I have mentioned like Amla Dravyas, Ruksha, Tikshna Dravyas, Kanjika, etc. Like Ashna Doshas should be checked. Excessive caffeine intake and canned food, refined food, etc. All junk food should be avoided. Vihara, smoking, alcohol, Vegadharana, Prajagarana, staying late in the night, Atishrama Vyayama during Ritukala, use of Apadravya, Ativyavaya on Varjikala. So all these should be avoided. These are apatyas. Then moving on to the discussion. So like I've said, Garbhadana is a very important and unique concept which is there in Ayurveda. So what is Garbhadana? Garbhadana is Garbha Sandharayate ena karmana. That is the method of conception they are talking. So this Garbhadana can be used as a preventive method and also a curative method. So those who are a healthy couple, it will act as a prevention or it will enhance their fertility. And those who have problem like infertility, difficulty in conception, it will act like a cure. So what is told under that? It has told so many things like what we have read under Shodhana, all that one is coming. So this is acting, Garbhadana is acting under 3 planes. One is our Yukti Vapashraya, whatever we have done, that is coming and acting on the physical plane. That is, it is clearing and curing all the ailments. And Sattva-Vajaya Chikitsa is acting on the psychological plane, handling the manas. And also Daivi Vapashraya Chikitsa is handling in the plane of consciousness. Like that, the Trivida Chikitsas, which are also mentioned in Garbhadana, are acting. So this Garbhadana Samskara can be used both preventive and curative. So here in Garbhadana, they're saying Yogya Stri for Vivaha, Ayogya Stri Purusha for Vivaha, they're talking. And then Yogya Vaya for Vivaha, different concepts they're saying, prerequisites they're saying, so that abnormal traits are not getting into the offsprings, or there will not be any difficulty. If partners are selected properly, then there won't be any difficulty in conception. And also as the age progresses, the fertility decreases because all the good ovums get ovulated first and the abnormal ones or less good ones or less effective ones will retain. So that's why it is better to conceive with before 35. After 35, the fertility declines. So, and also they have spoken about what are the coital activity, when to be done, and indicated, contraindicated, all that has been mentioned under Garbhadana Samskara. And then in that, like they have told Snehana, Swedana, Vamana, Virechana, we have already discussed, that is all coming under the physical plane, Yukti Vapashraya Chikitsa. First is Shodhana Karma, and then followed by Shodhana, they have told Patya Ahara for the couple. For female, it is Tila and Masha, because Artava is the Agnya for ovulation. For Shukra, for men, it is Shira and Rita. So Shukra is Somatmakam. So this diet has been told for a month, and then Brahmacharya has to be followed. And then they have told for coital activity. So this is what has been mentioned in Garbhadana Samskara. And this Shodhana, Shamana, and Patyahara is for handling the physical ailments, and also the Yukti Vapashraya, what has been told, is taking care in the psychology. That is, once the Saumanasya, by practicing meditation, by practicing yoga, by practicing Dinacharya, Sadruta and all, the mind will be balanced. And once the mind is balanced, definitely the couple will be able to, there won't be any stress, and the couple will be able to conceive. Saumanasyam Garbhadharanana. And then lastly, care in the plane of consciousness, that is Daivi Vapashraya Chikitsa. So direct reference is there for Putresti Yagya and chanting mantras. So that can be adopted, and it can be handled. So the factor which we don't know, that will be handled by this. And then I'm showing few case reports. I'm not talking the entire case here. So there's a couple, so having anxious to conceive since 5 years, and here the main problem for the lady is PCOS. The report I have attached, and we have given in that lady, we have given Virechana Karma for Sneha Pana, we have given Mahatikta Krita, and Trivrit Lehya is given for Virechanartha. And then after Virechana, Shamana Aushadhis are given, Falagrita and Pushpadhanvarasa. For 3 months, we have given medicines with Patya, and we have put on 3 months of medicine. At that time, we have told her to go for regular unprotected sexual activity. So after 6 months, she has conceived, and this is a report, 12 weeks and 4 days, the conceived report. This is the case 1. And then another case, this couple is anxious to conceive since 2 years. So lady is having anovulation. If you see this, there is report, there is no dominant follicle and there is no rupture also. So this is a follicular study of this patient. So in this lady, we have given Yoga Basti with Yeranamuladi Viruha, and then Mahanarayana Taila Anuvasana Basti is given. After this, we have given Uttar Basti with Falagrita, and then followed by Shamana Aushadhis, that is Falagrita, Pushpadhanvarasa, and Ashwagandha Kshirapaka. along with Patya Apatya. So this patient conceived after 3 months, and this is a report again. NT scan report. Then the third case is this lady is anxious to conceive since 8 years. Her main complaint is dyspareunia. So for that, we have done Sthanika Chikitsas like Yoni Abhyanga with Balataila, Yoni Parisheka, Prakshalana with Trifala and Gudishikashaya, Yoni Pichu with Udumbara Phala, fresh Kalka we have put. And then for 7 days, we have done this treatment. And then along with that, we also gave, because she was very anxious, we have given her SABS also, and Shirodhara we have given it to Brahmi Taila, along with Shaman Aushadhis, that is Falagrita. And for her, we have given Putranjiva, Shivalingi and Ashwagandha Churna. And along with Patya Patya, this lady also conceived after 3 months. And this is the report of her NT scan. So these are the successful cases. One was Virechana, one was Basti, Uttara Basti, and one was Thanika Chikitsa. This I could compile like this. So coming to the conclusion. So evam yonisha shuddhasu garbham vindanti yoshitaha. Definitely after, once the purification has happened, both Sharira Shuddhi and Manas Shuddhi, the conception will definitely happen. That is yonisha shuddhasu garbham vindanti yoshitaha. So Ayurvedic treatment modalities ensures Bija Shuddhi, improving the quality of sperm and ovum, Kshetra Shuddhi to raise the status of endometrial receptivity, and Manoshuddhi to develop the pure consciousness, which will help in correcting Sri Madhyatva and also uplifting the human race by getting Shriyasi Praja. So proper evaluation and timely intervention is the key for success. So these are my references. Thank you. So if
Excellent, excellent, Dr. Rajni, excellent.
thank you, sir.
Creative presentation as well as mesmerizing orientation. Great. बहुत अच्छा लगा आपका आदरणीय कामिनी जी
जी बहुत very nice presentation, and your slides were very nicely, beautifully prepared.
Yes.
Everything, yeah, all the aspects were also covered. Ayurveda aspect, modern aspect, treatment aspect, case presentation, everything you have covered. Excellent presentation.
Thank
you. And one request I wanted to tell you that kindly elaborate last case, dyspareunia.
Ma'am, dyspareunia, I'll show this slide. This patient, ma'am, she was not able to have proper coital activity because she had fear of sexual intercourse. Mostly it is not vaginismus, ma'am, and all, but she had little fear, and also her, because she did not have frequent coital activity, it was very tight, and she's not able to have penetrative intercourse. So in this patient, what we have done is we have done Yoni Abhyanga and Yoni Parisheka and Pichu we have done, and daily we used to massage, ma'am. Initially we used to massage with 1 finger, then 2 fingers, like that, slowly as the patient is comfortable. We have done that, and we have told her to do self also at home. So that has helped her in having a normal coital activity, and then later she conceived now. So this is what we have done in this patient. Only local treatment we have given, along with the external therapies like Shirodhara and Sarvanga Abhyanga. Vashvasveda.
Okay. So you thought that Shirodhara was also required in this case?
Yes, ma'am, because she was very stressful. She was very
Okay.
stressful and anxious, ma'am. Until unless she's not calming down from her mind, if we do local treatment also, she'll keep it very stiff and she'll not cooperate. So together we have adopted, and then we have done.
Okay. And you have used Yoni Pichu with Udambara.
Yes, ma'am, Udambara Kalka. First, initially smaller Pichu was kept, later the size was increased gradually.
And what was the logic behind the selection of Udambara?
Actually, ma'am, Udambara is it is used for Yoni Gadikarana only, but here we have seen that vaginal canal is little inflamed, so that is what we have placed Udambara Kalka Pichu.
Okay.
But otherwise, Udambara is for Yoni
Udumara is
only, but
doing
here
constriction. Udumara
yes,
do
ma'am.
constriction. Then,
Yes, but here he wanted to reduce the inflammation also, so that was chosen.
Okay. Nice. Anybody else want to ask question? You can take up one or two question. किसी को पूछना है?
Excuse me, ma'am. Yeah, ma'am, in the case of PCOS, what was like the more menstrual history of the patient and then the body weight of the patient, whether she was obese, whether she was lean? How was the patient, ma'am? What was the criteria for the selection and of the Panchkarma as well as the medicine, ma'am? Can you please explain in detail?
In this lady, she had, of course, she was. I did not mention the entire case. I have mentioned only the condition and the treatment. But in that patient was little overweight also, and she was not ready for Vamana. So in that patient, we have taken for Virechana. Actually, she is obese, but we could have taken for Vamana, but patient is not cooperative, so we have taken her Virechana. And her menstrual, she had irregularity in her cycle every after 45 days only. But on onset is natural. We don't induce her cycle. It used to come on its own. But there was oligomenorrhea kind of a situation there. So that is her menstrual history. And whenever she gets periods, it is only for 2 or 3 days, and that too 1 pad or 2 pads she uses, not more than that. So hypomenorrhea and oligomenorrhea both were seen in this patient. So ideally it was for Vamana, but patient was not ready for going for Vamana. So we have taken up for Virechana, and then she conceived.
Okay, ma'am. Ma'am, even if the endometrial thickness, do we have to see, ma'am, when like oligomenorrhea, main hypomenorrhea and all, maybe they'll have less endometrium also.
Yes.
So there's is there any specification of medicines, ma'am, for that when we
endometrial receptivity?
Panchkarma, and if they are having hypomenorrhea due to decreased endometrial thickness?
So in that case, first thing we can do is we can go for basti. In Yapana bastis or Kshira bastis, Matra bastis can be done. After that, next sitting one can go for Uttara basti, so that the endometrial receptivity and quality will be improved.
Yes, ma'am. Thank you.
And also in this case, in such cases, Nasya karma also can be adopted if there is any HPO axis problem. Nasya also will help if
yes, ma'am. Yes, ma'am.
possible.
Okay,
And drugs like Phalagrita, Shatavari Grita, or any Kshiropakas can be used. Ashwagandha Kshirapaka, Shatavari Kshirapaka can be used. Shatapushpa Shatavari Kalpa can be used.
Yes, ma'am. Thank you, ma'am. Ma'am, Kamini, ma'am, you had told to give that Brahmigrita Nasya, no, ma'am, last time in one of the cases of this to maintain the HPO axis in teenage. This one. So instead of Brahmi, can we also substitute with Yashti Tela, ma'am?
डॉक्टर कामिनी धीमान जी, मैं वैसे बता दूं कि मैंने नेक्स्ट वेबिनार 10 बजे, तो इसीलिए चिंता नहीं है, आराम से हम लोग 10 बजे तक डिस्कस कर सकते हैं.
बीच में सुन नहीं रहा था.
Ma'am, yeah, ma'am, I was asking, ma'am, in one of the cases you had told me to give that Brahmigrita Nasya for the teenager patient who was having delayed menses with prolonged bleeding. So you had told about Brahmigrita, ma'am. Matlab, when the patient came, actually there was Brahmigrita stock was out. So I substituted with Yashti Tel also. So that also would be okay, ma'am. Yashti Tela Nasya, even if to replace with Brahmigrita Nasya.
Can you hear me?
No, ma'am.
Yeah, I was telling that Yastitel is not the substitute of Brahmi growth. You can use Anutel instead of Yastitel.
Yes, ma'am. Yes, ma'am.
That will be much better than that.
Yes, ma'am. Thank you, ma'am.
Yeah. किसी और का कुछ डाउट है तो पूछ सकते हैं.
Ma'am, one more case, ma'am. She's 32 years old. She
Mhm.
had fibroids, around 8 fibroids. Largest was 4 centimeter, along with endometriosis of right ovary and left ovary. There were multiple small follicles. So for such a patient, she has undergone fibroidectomy, and this one endometriosis cyst is also being removed by laparoscopy. Now, for this patient, if she wishes to have a normal pregnancy now with Ayurvedic treatment, so how can we go ahead with this case, ma'am?
What was the last operation? When was that?
Just 5 days back.
5 days back. Then you have to
Yeah.
give gap of 2 years.
2 years.
Yeah, 2 years. At least 1 year. 2 years. It is
Even
better.
even for laparoscopy, ma'am.
But uterus is
Yeah.
operated. No, fibroid was removed from
Okay.
uterus. Uterus needs strength.
Strength too. Yes.
Uterus
Ma'am.
needs strength.
No, ma'am.
So
By then, will not there be regrowth of this fibroid and endometriosis?
no, you
But we
can
can.
give the oral medication along with that.
What could be the medications, ma'am? Can we give panchkarma also, or what kind of panchkarma
Yeah,
can we give
Panchkarma
for?
you can give, but
Excuse me, ma'am.
मैम ऑपरेशन के बाद पंचकर्म कैसे करेंगे अभी? नस से है, ये सब शिरोधारा ये सब तो कर सकते हैं.
मतलब how long have we to wait to give any kind of
then
panchkarma?
you do Yogavasti also in this case.
Yes, ma'am. Which basti, ma'am, of that? Yoga basti.
Yogavasti.
Okay, and medications, ma'am?
Medication you can decide as per the patient. Oral medications, associated complaints, what is her cost, her prakriti. According to that, you have to decide. No?
No, mainly to that is all. Matlab, she's not having any specific symptom. Even her menstrual cycle was around 25, 27 days cycle with moderate bleeding, not scanty, not heavy, just moderate bleeding of 3 days, and associated her digestive system and all were mostly normal and moderate build.
See, when patient is having endometriosis, then always there is pratilom apan vayu. Okay, and apan
Okay.
vayu is pratilom. Patient must be having problem with her coast.
Yes, ma'am. No, only on heavy food sometimes she used to have disturbances. Otherwise, normally she passes motion satisfactory, and she didn't have any kind of endometriosis system, neither pain or heavy bleeding, nothing of that sort, ma'am.
No, but you told na that she had operated for that endometriotic cyst.
That is just 5 days back. She
5
never
days
had
back.
history of dysmenorrhea, no history of heavy bleeding at all. In fact, it was scanty to moderate kind of bleeding. Just 3 days, some 4 to 5 pads.
The case was not that much chronic, I think so. So
Yeah,
that's why.
5, 6 years of married life, ma'am. Never got pregnant.
That's why she was not having any problem. But upon vayu is deranged, then only she will have this endometriosis and uterine fibroid, everything. So that should be corrected. Other than that, she will not be fine without Yogavasti.
No, ma'am, any specific medication to prevent the regrowth of fibroids and endometriosis?
So I'm telling you have to control her upon what? I have not seen the patient, so you have seen the patient. So You can understand her Agni, Coast, Prakriti, what is the status of the patient. According to that, you have to modify the treatment. We cannot
Yes, ma'am.
do a disease-specific treatment. We do patient-specific treatment, no?
Yeah.
Yeah. So you have to understand the patient, and then you have
Yes,
to advise. So we are having n number of medications. So
yes, ma'am. Yes, ma'am.
yeah.
Thank you, ma'am.
But apanway correction, Anuloman, Agnideepan, that should be done. And explore whether she is having any stress factor also.
Yes, ma'am. Yes, ma'am. Thank you, ma'am.
मैम आपने योग बस्ती के लिए बोला, नमस्ते मैम। तो ये
हम्म।
जैसे इन्होंने पूछा कि कितने दिनों के बाद हम कर सकते हैं, तो 5 दिन ही हुए हैं अभी सर्जरी के, तो ये कब से स्टार्ट करेंगी?
अभी नहीं बोला मैंने, 3 महीने बाद विरेचन कराने के बाद बोला, अक्टूबर के बाद।
जी जी।
वो पंचकर्मा कराना चाह रही है, तो मैंने कहा 3 महीने बाद अक्टूबर में आप विरेचन प्लान करो, वो हो जाएगा, उसके बाद गैप देख के फिर योग बस्ती कराओ, ऐसे। अभी तो कुछ भी नहीं करा सकते ना, अभी अभी तो ऑपरेट हुआ है।
जी
हम्म। रामवीर सर बहुत दिन बाद दिखे हैं, सर हैं क्या?
यस मैम, यस मैम।
जी सर, आप अपना ओपिनियन दीजिए आज के
मैं
टॉपिक पे।
सभी को नमस्कार। मैं आप लोगों की चर्चा अच्छी तरह से सुन रहा था। बड़ा अच्छा ही रजनी जी को मैं बधाई देता हूँ, बहुत अच्छा प्रेजेंटेशन उन्होंने दिया, सभी एस्पेक्ट को उन्होंने टच किया। सबसे बड़ी बात तो उन्होंने ये बताया कि हम लोगों को अपनी लिमिटेशंस देखनी पड़ेगी, लिमिटेशंस के आधार पे अपने को ट्रीटमेंट करना है। और दूसरी चीज उन्होंने बताया कि पुरुषम वीक्षक, पेशेंट टू पेशेंट, बहुत सारी मेडिसिन उन्होंने लिखी थी, मगर एक मेडिसिन हर पेशेंट को नहीं दे सकते, और हर पेशेंट को कई मेडिसिन नहीं दे सकते। तो अभी आपने जैसा मैडम ने बताया कि पेशेंट को प्रकृति देखेंगे, दोष देखेंगे, दुष्ट देखेंगे, कोष्ठ देखेंगे। अभी मैम ने जस्ट बात करी, जब चर्चा चल रही थी, अब मान लीजिए किसी की फेलोपियन ट्यूब का डिसऑर्डर है, और फेलोपियन ट्यूब अगर उसकी ओपन अलग तरह से फेलोपियन ट्यूब की बात आती है, तो मैनी टाइप्स ऑफ द ब्लॉकेज होते हैं। सबसे पहले ब्लॉकेज होता है म्यूकस प्लग का, दूसरा ब्लॉकेज होता है स्पाज्म का, तीसरा प्लग होता है एडिशंस का, चौथा प्लग होता है स्ट्रिक्चर्स का। अगर माइल्ड स्ट्रिक्चर्स है तो उसके अंदर उत्तरदृष्टि के द्वारा रिजल्ट मिल जाता है, मगर कब? जब उसकी ब्लॉकेज मिडिल में हो या प्राइमरी लेंथ हो। मान लीजिए इंटरस्टिशियल पार्ट में ही अगर ब्लॉकेज है तो वहां पर उत्तरदृष्टि अंदर जाती नहीं, उसमें कोई रिजल्ट नहीं मिलता। ट्यूबोप्लास्टी की बात आया थे, ट्यूबोप्लास्टी के भी रिजल्ट मात्र 27% है, वो भी प्राइमरी लेंथ पे अगर ब्लॉकेज है तो। अगर इंटरस्टिशियल पार्ट पे है तो उसके ब्लॉकेज के अंदर ट्यूबोप्लास्टी का भी कोई रिजल्ट नहीं है। अभी यह मैडम ने बात कर रहे थे जैसे एंड्रोमेट्रियोसिस और अपने फाइब्रोड की, तो उन्होंने मैम ने बताया कि मल्टीपल फाइब्रोड्स थे, एक मैक्सिमम 4 सेंटीमीटर का था, तो मायोमेक्टोमी हुई है तो क्या मल्टीपल फाइब्रोड निकाल दिए गए हैं क्या? संभव है कि 6 ईयर के अंदर इनफर्टिलिटी रही है तो मायोमास हैं या अपने उसके अंदर ट्यूमर्स हैं, तो निश्चित ही उसके अंदर इम्प्लांटेशन का कारण बनता है, इम्प्लांटेशन नहीं होगा। दूसरे उन्होंने बताया कि अपने एंडोमेट्रियोसिस की, तो एंडोमेट्रियोसिस में जरूरी नहीं है कि सभी पेशेंट के अंदर अपने को डिस्पेरियूनिया मिले या तो सभी पेशेंट में डिस्मेनोरिया मिले, एंडोमेट्रियोसिस के सभी सिम्टम्स मिले। एंडोमेट्रियोसिस के सिम्टम्स जब मिलते हैं जब ऑर्गन्स एक दूसरे के साथ में अपने एडिशंस होना शुरू हो जाता है एंडोमेट्रियोसिस की वजह से, तो प्राइमरीली रहा होगा इसलिए एंडोमेट्रियोसिस के सिम्टम नहीं मिले, मगर अगर एंडोमेट्रियोसिस जितने ज्यादा अपने फैलता जाता है उतने ज्यादा उसके अंदर डिस्पेरियूनिया उसमें भी होता है, और दूसरे उसके अंदर अपने डिस्मेनोरिया मिलेगा ही मिलेगा। तो ये इनिशियल रहा होगा। अब ऑपरेशन कौन सा किया है, लेप्रोस्कोपी किया है, लेजर से किया है, ओपन किया है, तो उसके आधार पर उसका मैडम ने सही बताया 3 महीने के बाद कर सकते हैं। अगर ओपन भी किया है तो भी 3 महीने के बाद में किया जा सकता है। और निश्चित ही ये हम इसके निष्कर्ष पर निकले, पीसीओडी के अंदर जितने भी हम लोगों ने अभी तक डिस्कस किया है उसमें विरेचन बहुत अच्छा काम करता है। अभी बात हुई उसकी क्या नाम एंडोमीट्रियम की, एंडोमीट्रियम की थिकनेस कितनी है, तो एंडोमेट्रियम की थिकनेस के आधार पर जो उनको मेडिसिन अपने को सेलेक्ट करनी पड़ेगी, कौन सी मेडिसिन दें एंडोमेट्रियम थिकनेस कम है तो उसके लिए मैडम ने बताया फल घृत है, शतावरी घृत है, अभी यष्टि मधु घृत की बात आई, बिल्कुल सही है। यष्टि मधु भी मेद्य रसायन बताया गया है और ब्राह्मी भी मेद्य रसायन बताई गई है। तो यष्टि मधु घृत की वो तेल की जगह पे यष्टि मधु घृत दिया जाए तो बेटर रहेगा नस्य के अंदर, क्योंकि दोनों का एक ही फंक्शन रहेगा। मेद्य रसायन होने की वजह से वो नस्य में जाएगा और वो हाइपोथैलेमस में जाके काम करेगा। नर्व को, जो नर्व्स ज्यादा स्टिमुलेट रहती हैं उनको घृत क्या करता है, समन का काम करता है, स्टिमुलेशन को कम करता है। जहाँ स्टिमुलेशन नहीं हो रहा है स्टिमुलेट देना है, तीक्ष्ण नस्य देने, तो नस्य के आधार पर भी तेल देना है या घृत देना है, तीक्ष्ण नस्य देना है या मृद नस्य देना है, तो ये नस्य के आधार पर काम करता है। ये काम करता है अपना न्यूरोलॉजिकल स्टिमुलेशन के ऊपर, वो भी अपने नस्य के द्वारा। जो पोस्टीरियर पिट्यूटरी है, डायरेक्ट थैलामस से तो कोई रिजल्ट नहीं है, मगर हाँ अपने जो ऑल्फैक्टरी नर्व है उसको स्टिमुलेशन करने के बाद ब्रेन के अंदर जाता है तो अपने हाइपोथैलेमस पर काम करता होगा, ऐसा मान सकते हैं। जिसका हाइपोथैलेमस बहुत ज्यादा स्टिमुलेट है उसको अपने घृत का नस्य देंगे, और जिसको स्टिमुलेशन नहीं देना, स्टिमुलेशन देना है उसको अपने को तेल का तीक्ष्ण नस्य दिया जाएगा, जैसा दिया जाता है। एक बात और आई थी, मैम ने बताया था जैसा कि कई बार पेशेंट आते हैं आईवीएफ के पेशेंट, मेरे पास भी पेशेंट आए 2-2 बार 3-3 बार आईवीएफ किया, वो फेलर हो जाए क्योंकि उसके अंदर रिसेप्टाइल अपने एंडोमेट्रियम नहीं होती है। वो लोग क्या करते हैं, एंडोमेट्रियम देखते नहीं और एंडोमेट्रियम को देखने के बाद में दे देते हैं, रिसेप्टाइल नहीं होने की वजह से 3-3 बार फेलर हो जाता है। मेरा ऐसा मानना है, हम लोग जो दाढ़माती घृत देते हैं, यष्टि मधु घृत देते हैं पेशेंट को, उससे अपने एंडोमेट्रियम के अंदर रिसेप्शन बढ़ता है और उसके रिजल्ट भी मिलते हैं। 3-3 फेलर होने के बाद आयुर्वेद का मेडिसिन देते हैं, उसके बाद आईवीएफ कराते हैं, तो उसका रिजल्ट हम लोगों को बहुत अच्छा मिला है। तो इसमें हर पेशेंट को किस तरह का अपने कॉम्प्लिकेशन क्या है, एलोंगेशन ऑफ द सर्विक्स है। एलोंगेशन ऑफ सर्विक्स के अंदर हम कितना भी ट्रीटमेंट कर लें, जब तक उसका एम्पुटेशन नहीं होगा तब तक उसके अंदर रिजल्ट नहीं मिलेगा। चाहे अपने, और मैम ने बताया यूट्रस की आपने जस्ट बात की, अभी हम लोगों की डिस्कस हो रहा था, यूट्रस के अंदर क्या है, फाइब्रोड है, दूसरा क्या है, एंडोमेट्रियोसिस है। तो दोनों ही कारण, फाइब्रोड में क्या होता है, फाइबर टिश्यू बन जाते हैं। फाइबर टिश्यू किसके बनते हैं, बात की वजह से होते हैं। जहाँ पे फाइब्रोसिस हो रही है वहाँ पे बात बढ़ा हुआ है, जहाँ पर एंडोमेट्रियोसिस हो रही है वो बात का विलोम गति हो रही है, तो उसमें अनुलोमन, अभी मैम ने बताया था, दोनों में ही वस्ती काम करेगी। वस्ती इस तरह से काम करेगी, वो पोषण, वस्ती को बताया गया है गर्भाशय गर्भाशय से बल प्रथम, तो गर्भाशय को बल का मतलब गर्भाशय को पोषण करेंगे, सॉफ्टनेस गर्भाशय की बढ़ानी है, उसके अंदर फिर से फाइब्रोड नहीं हो, फाइब्रोड होगा बात की वजह से। ऐसे ही एंडोमेट्रियोसिस के अंदर भी बात का विलोम हो रहा है, इसको कहते हैं अपने प्रतिलोम गति कहते हैं, जिसको आर्तव की प्रतिलोम गति हो गई है, तिर्यक गति हो गई है, तो उसको भी अनुलोमन के द्वारा ही ठीक होगा। मेडिसिन कौन सी सेलेक्ट करनी है ये पेशेंट के ऊपर डिपेंड करता है। मेडिसिन कौन सी देनी है, किस तरह से, किस रूट से देनी है, लिम्बिक सिस्टम को ठीक करना है, अपने एचपीओ सिस्टम को ठीक करना है, या अपने लोअर पार्ट में वो है इनफर्टिलिटी, तो एक एक पॉजिटिव फैक्टर के आधार पे ट्रीटमेंट चेंज हो जाएगा। अभी हमने बताया जस्ट कि अपने जो उत्तर बस्ती दे रहे हैं उससे पहले अभ्यंग कीजिए। एक आध बात आई थी वेजानिस्मस की और डिस्परयूनिया की। वेजानिस्मस जहाँ तक की बात है वो साइकोलॉजिकली होता है, अपने जो योनि संकुचित बताया है। अजात रजसाम स्त्रियाम, अगर अजात रजसा स्त्रिया है उसको अंदर कृत्य एक मैथुनम, तो उसमें स्पाज्म हो जाता है, वेजानल स्पाज्म होता है, उसमें अभ्यंग और स्वेदन करेंगे तो उसके अंदर स्पाज्म दूर होगा, और नष्ट देंगे तो उसके अंदर फियर दूर होगा। फियर की वजह से, फोबिया की वजह से वेजानिस्मस होता है। डिस्परयूनिया होता है, उसके अंदर पैथोजेनेसिस कहीं ना कहीं होती है, इन्फ्लेमेशन होता है, तो वहाँ लोकल ट्रीटमेंट काम करेगा। तो दोनों ही अलग अलग चीजें हैं, मगर उनको दोनों तरह से ही ट्रीटमेंट किया जा सकता है। और वेजानिस्मस है तो उसके अंदर अपनी साइकोलॉजिकल ट्रीटमेंट भी देना पड़ेगा, और अगर डिस्पेरिमिया है तो उसमें फिजिकल ट्रीटमेंट ज्यादा काम करेगा। जहां तक बात है युक्ति व्यापाश्रय की, तो युक्ति व्यापाश्रय का बहुत कम चिकित्सा है, इसमें ज्यादातर मन की चिकित्सा की गई है। तो सत्वावजय और देव व्यापाश्रय, सत्वावजय और देव व्यापाश्रय दोनों की दोनों चिकित्सा वो सारी की सारी मन के ऊपर काम करती है। मन एंडोक्राइनोलॉजी के ऊपर काम करता है, और एंडोक्राइनोलॉजी अपने पूरी तरह से मेंस्ट्रुअल और रिप्रोडक्टिव सिस्टम पर काम करती है। तो 1/3 तो है अपने युक्ति चिकित्सा, और 2/3 है उसमें मानसिक चिकित्सा। सोमनस्कम गर्भकराणम, सोमनस्कम अकेले पति का नहीं, अकेली पत्नी का नहीं, दोनों का इस मंच में होना चाहिए, और उसके अंदर विल पावर होनी चाहिए बच्चा चाहने की, तो इसका अपने रिजल्ट मिलता है। ये सारा का सारा एंडोक्राइनोलॉजी पे काम करता है। हाँ, देव व्यापाश्रय में क्या करेंगे, पेशेंट को बताएं सवेरे सवेरे जाइए, पीपल के पेड़ पे 6 बजे जाके आपको जल चढ़ाना है। तो वो क्या करता है, सुबह जगता है टाइम पे, नहाता है, नहाने के बाद पीपल के पेड़ पे जाता है। उसकी तो सर्केडियन साइकिल है, वो सर्केडियन साइकिल एकदम रेगुलर हो जाती है उस देव्यापस्त्र की वजह से। और सर्केडियन साइकिल रेगुलर होती है तो हार्मोन्स रेगुलर हो जाते हैं, हार्मोन रेगुलर होते हैं तो रिप्रोडक्टिव सिस्टम काम करने लगता है। तो ये पीसीओडी है, हाइपोएस्ट्रोजेनिक कंडीशन है, कॉर्पस लुटियल फेलियर है, ये सारी की सारी चीजें, अपने बहुत सारी चीजें लाइफ स्टाइल अगर ठीक हो जाती है, ठीक हो जाती है। तो ये जो देव्यापासर में कहते हैं कितना मंदिर में जाना ही है, पूजा पाठ करना ही है, तो उसके सर्केडियन साइकिल ठीक होने से बहुत सारे रिजल्ट मिलते हैं, ऐसा मेरा मानना है। तो पॉजिटिव फैक्टर देखते हुए और उसको अपने को ट्रीटमेंट करना है पेशेंट को। हर पेशेंट के अंदर एक ही ट्रीटमेंट करें। हाँ, निश्चित ये बात जरूर आई अब तक के डिस्कशन में कि पीसीओडी के अंदर हम लोग बीजम भवती कारमुकम वस्ती और विरेचन, वमन की अपेक्षा वस्ती और विरेचन को अनुलोमन है, बात नहीं बाता योनि नारीणाम संप्रति। तो अपने को अनुलोमन, पित्त भी अनुलोमन करता है। पित्त के अनुलोमन के लिए कहाँ कहा गया है, जहाँ पर तमकेत अपने उसमें तमकेतु विरेचनम में कहा गया है कि तमक में विरेचन क्यों देते हैं, कि तमक में इसलिए देते हैं कि बात का अनुलोमन होता है, वहाँ विरेचन इसलिए देते हैं। तो विरेचन तमक का भी अपने अनुलोमन भी करता है। और पित्त अधिक मात्रा में बढ़ा हुआ है और कम है तो उसको पित्त का भी साम्यावस्था में लाता है। वस्ती बात का समन करती है, तो इस तरह से ओवरियन फंक्शन को ठीक करती है। वह अपने वास्कुलरिटी जो है, ब्लड सर्कुलेशन है, यूट्रस को, ओवरी को, फैलोपियन को, उसको ठीक करती है। तो वस्ती और विरेचन का निश्चित ही रिजल्ट है, तो इसको हम लें। और मानसिक रूप से जैसे सिरोधारा है, सिरोधारा की अपेक्षा मेरा मानना है नस्य बहुत अच्छा काम करेगा। सिरोधारा का जो है, सिरोधारा का सिर्फ रिजल्ट इतना रहता है कि एक्सटर्नल न्यूरॉन्स हैं जो स्किन के अंदर हैं, उसके ऊपर रिजल्ट देता है, उससे रिलैक्सेशन जरूर मिलता है, मगर स्ट्रेस है, एंजाइटी है, सारी के सारे नर्स के द्वारा रिजल्ट तो देंगे, प्रतिमर्श नर्स हो चाहे किसी तरह का नर्स हो। इस तरह से पेशेंट के अनुसार पैथोलॉजी को देखते हुए, पॉजिटिव फैक्टर को देखते हुए और समीक्षा करते हुए उसकी डोज की कितनी है, क्या कौन सा डोज है, तो रिजल्ट निश्चित ही रिजल्ट मिलते हैं। तो आपने मुझे बोलने का समय दिया, आप लोगों ने मुझे सुना, उसके लिए बहुत बहुत धन्यवाद। और दीपिका जी को बहुत धन्यवाद, बहुत अच्छा प्रश्न करती है और अच्छे प्रश्न जब ही आते जब अपने पास पेशेंट आते हैं। मैम ने बताया शिकायत कर देती है, नहीं नहीं पेशेंट एक्चुअली मैं शाम को 6 बजे के बाद ही देखता हूँ। पेशेंट आ जाता है तो आधा घंटा 20-25 मिनट खा जाता है, तो डिले हो जाता है। तो इस तरह से मैं थोड़ा कभी कभी पूरा सुनने की कोशिश करता हूँ और समझने की कोशिश करता हूँ, सीखने की कोशिश करता हूँ। थैंक यू वेरी मच, धन्यवाद।
जी, थैंक यू सर। Anybody else want to ask the question? Manjushri? मंजुश्री बोल रही हो क्या? आवाज नहीं आ रही है।
हेलो।
हाँ, आ रही है अब।
हेलो।
हाँ हाँ, बोलो बोलो, आई आज।
नमस्ते।
नमस्ते।
अच्छे। हाँ, बहुत सारे पेशेंट्स आते।
तुम थोड़े नेटवर्क एरिया में हो, नेटवर्क में आवाज नहीं आ रही। या तो मेरे में ही प्रॉब्लम है, मेरे नेटवर्क में इशू सुनाई नहीं दे रहा है।
हेलो।
हाँ बोलो।
हेलो।
हाँ अब आई, अब आई।
मैडम अभी, जी जी मैडम, अभी कुछ पेशेंट आते हैं जैसे उनका वो AMH लो होता है, जैसे अभी सर ने बताया ना, जस्ती मधु तेल की वजह से अगर हम घृत देंगे तो वो पूरा हमारे जो नर्वस सिस्टम पे काम करेगा। तो ऐसी पर्टिकुलरली कौन सी मेडिसिन हम सिलेक्ट कर सकते हैं? जैसे अभी सब जगह पे बस्ती वगैरह देते हैं ना मैडम, इसमें अनुवासम बस्ती वगैरह देते हैं AMH में कम जब होता है। तो ऐसे पर्टिकुलरली कौन सी मेडिसिन हम दे सकते हैं उन पेशेंट को?
उसमें रसायन चिकित्सा करनी पड़ेगी आपको। अकॉर्डिंग टू पेशेंट डिसाइड करो कि आपको इस पेशेंट के अकॉर्डिंगली कौन सा रसायन सही लगता है, कौन सी रसायन बस्ती, बस्तियां भी बहुत सारी, यापन बस्ती, ब्रहण बस्ती, कई सारी है, वो दे सकते हो। या रसायन मतलब ओरल घृत वगैरह भी दे सकते हो अगर पेशेंट ले सकती है, आपको लगता है कि हाँ ये इसका अग्नि ठीक है, तो वो भी दे सकते हो आप।
मैडम
ओरल
जो भी
मेडिसिन
आते हैं ना
मतलब।
पेशेंट, जैसे हाँ मैडम, जो भी पेशेंट आते हैं ओरली तो हम देते हैं उनको, जैसे
हाँ,
पॉलकलन घृत वगैरह वो तो दे दिया, लेकिन पर्टिकुलर में ये पूछ रही थी कोई बस्ती के लिए कौन सा ऑयल या जो भी पर्टिकुलरली कौन सा ऑयल हम चूज करेंगे इस केस
बला
में?
बला तेल,
जी जी।
बला तेल, बला
एग्जैक्टली
चूर्ण
उसका,
ओरली। हाँ
एक्चुअली इसका मतलब क्या मोड ऑफ एक्शन, कैसे क्या हम उसको कर सकते हैं?
रसायन, इसका मोड ऑफ एक्शन ही रसायन है ना,
जी जी।
रसायन देना। वैसे तो जनरली मेरा तो ये तरीका है कि मैं तो कभी एएमएच फोकस ही नहीं करती हूँ, पेशेंट को ना कराती हूँ ना देखती हूँ, उसको काउंसलिंग कर
तो
देती
मैडम
हूँ कि
वो
इसको
लोग,
तुम्हें एएमएच से क्या लेना है, तुमको फॉलिकल चाहिए हम बना देंगे, एएमएच क्यों देख रहे हो तुम भैया, हम तो देखते ही नहीं,
सेम
मैं तो मना ही
कॉन्सेप्ट है,
करती हूँ।
लेकिन सारे पेशेंट आते हैं वो पहले से एक्चुअली मैडम सारे
करा
रिपोर्ट
के
लेके
आते
आ
हैं, हाँ
जाते हैं
करा के
और
आते हैं, फिर उनकी काउंसलिंग करनी पड़ती है, उनको समझाना पड़ता है कि आपको एएमएच देखना क्यों है, रोल क्या है, पूरा समझाना पड़ता है ना, वो
ये आपने
एमएस
बताया
लेके आप
क्या क्या
स्ट्रेस क्यों
लेना
ले
है।
रहे हो, ऐसे काउंसिल करना पड़ता है ना।
ठीक है ठीक है। और एक मैडम, एक पेशेंट है वो इनफर्टिलिटी की नहीं है, उसने कंसीव किया है, लेकिन उसको वो बाइकॉर्नर यूट्रस है, अभी 2 मंथ्स प्रेगनेंसी है उसको, तो उसको हम आयुर्वेद में क्या कर सकते हैं, वो चलिए पूछ रही है।
नहीं, बायोकॉनिक ट्यूटर से तो कितना पोर्शन, मतलब बिल्कुल ही दो हिस्से हैं कि अलग पोर्शन है, 3/4 है, ऐसा है, स्ट्रक्चर देखो ना कैसा है उसका। कई बार बायोकॉन्वेट में एक्स्ट्रा हॉर्न रहता है तो उसमें तो सरवाइव कर
छोटा
जाता है
सा हॉर्न
बेबी,
होता है तो
हाँ छोटा सा हॉर्न है, लेकिन बीच में से ही
वो तो
वो दो हिस्से हुए हैं
नहीं,
तो
उसका मैडम वन साइड में छोटा सा हॉर्न तो है,
हम्म,
लेकिन जो भी है उसमें थोड़ा चांसेस रहता है ना वो मिड टर्म अबॉर्शन के लिए, तो उसको हम एक्सटर्नली ऐसा कुछ भी कर सकते हैं क्या, जैसे कोई भी
नहीं
ऑयल
स्ट्रक्चर तो
वगैरह
नहीं चेंज कर
एप्लीकेशन के
सकते ना
जैसे,
आप, अगर दो हिस्से
हाँ
ही उसके ऑलरेडी
फर्टिलिटी
बने।
बढ़ाने के लिए।
नहीं नहीं,
मैं एक्चुअली
स्ट्रक्चर नहीं
वही
चेंज कर
सोच रही,
सकते ना।
मतलब कोई भी उसको कैसे भी करके कुछ हेल्प कर सकते हैं आयुर्वेद में, जैसे वो पूछ रही थी तो।
डिपेंड अपन ना, उसका स्ट्रक्चर देखना पड़ेगा ना, अगर उसके पास पहले का एचएसजी वगैरह है तो उसी से आइडिया लगेगा आपको कि हाँ एचएसजी से कि उसका
एक्चुअली मैडम वो
बाइकोलेट है
पहले
तो
उसका
कितना।
अल्ट्रासाउंड हुआ था, बहुत पहले का अल्ट्रासाउंड का रिपोर्ट है,
अल्ट्रासाउंड
लेकिन
में
अभी
क्लियर नहीं पता चलता है, इसका गोल्ड स्टैंडर्ड
उसमें बस
डायग्नोसिस
वही लिख दिए
बाइकोलेट
हैं।
का या स्ट्रक्चर का
अभी तो वो अभी तो
जो
वो कंसीव कर
generally,
चुके हैं ना मैडम, हाँ अभी कंसीव कर चुके हैं, उसमें तो अभी कुछ
अभी
नहीं
नहीं,
कर
अगर
सकते हैं।
पहले का बोल रहे ना, पहले का एचएसजी अगर है
पहले का
आपके
बस
पास,
वही, नहीं मैडम वो नहीं है, सिर्फ एक अल्ट्रासाउंड का रिपोर्ट है उसमें वही लिखा है, लेकिन अभी वो कंसीव तो कर चुके हैं, अभी उसको
ठीक है वेट
वही
एंड
तो
वॉच और क्या,
क्या करेंगे,
वेट
हाँ
एंड वॉच,
थोड़ा
हैवी
और हेल्प कर।
एक्सर्शन वगैरह के लिए मना करो, वेट एंड वॉच।
एक्चुअली एक्चुअली मैम, इसमें आपने जो बताया वायु कोऑर्डिनेट यूटरस में अगर एक्स्ट्रा हॉर्न है
हम्म,
और
जी सर।
जो एक साइड का अपने वो है, वो लार्ज साइड वाले में अगर प्रेगनेंसी हुई है तो उसके
जी
अंदर डिस्टेंशन कितना हो सकता है, तो निश्चित ही इसमें ये मान के चलिए कि पूरी तरह से 40 वीक्स तक तो जा नहीं सकता, 36 वीक में भी जाना मुश्किल रहेगा।
वही
ऐसी
बोल रही
कंडीशन
हूँ।
ऐसी कंडीशन में क्या होता है, इसमें जो फाइबर टिश्यू ज्यादा होते हैं, मस्कुलेचर कम होता है, मायोमीट्रियम कम होती है, पेरीमीट्रियम और फाइबर टिश्यू ज्यादा होते हैं, इसलिए एबॉर्शन की संभावना रहती है, एबॉर्शन में भी अपने उसके अंदर सेकंड ट्राइमेस्टर के अंदर। तो इसके लिए अपने को मसल रिलैक्सेंट देने पड़ेंगे। मसल रिलैक्सेंट में हम लोगों के अंदर हम लोग सबसे ज्यादा देते हैं जो सर्वाइव करने के लिए, वो देते हैं शतावरी। तो उसके अंदर शतावरी दें, शतावरी घृत दें, बेदारी कंद दें, इनका रिजल्ट मिलेगा, इसके अलावा और कोई ज्यादा ट्रीटमेंट नहीं दे पाएंगे हम।
जी जी सर, थैंक यू थैंक यू।
बाकी के वो लोग तो प्रोजेस्टेरोन देंगे ही, प्रोजेस्टेरोन मसल रिलैक्सेंट होता है और इस तरह से डिस्टेंशन ऑफ द यूट्रस की जो मस्कुलेचर है उसको रिलैक्स करता है, तो उससे अपने थोड़ा डिस्टेंशन 32 वीक तक ज्यादा खींच सकते हैं, बहुत ज्यादा। अगर पूरी तरह से हॉर्न इस तरह पे छोटा से हॉर्न है, एक साइड में पूरा एक हॉर्न पूरा बड़ा हुआ है, तो निश्चित ही वो 36 वीक तक जा सकता है, डिपेंड करता है एनाटॉमिकल डिफॉर्मिटी के
वो
ऊपर।
30 वीक्स क्रॉस करके फिर तो सर्वाइवल चांसेस बढ़
हाँ फिर
जाएंगे
तो
ना,
सर्वाइवल
उससे
हो जाए। हाँ
हाँ उससे कम में रह गया तो मुश्किल
जी, हाँ जी, आपने
है ना।
बिल्कुल सही कहा, अगर हॉर्न के ऊपर डिपेंड करता है किस हॉर्न के अंदर इम्प्लांटेशन हुआ है।
हाँ हाँ हाँ, बस बस वही है ना,
जी,
वो देखना पड़ेगा ना
उसको ओरली
स्ट्रक्चर क्या है,
कुछ
ऐसे तो
वगैरह
ओरली
दे
नहीं
सकते
पता
हैं क्या
चलता ना,
ओरली?
बायोकॉर्नेट है तो कितना
हाँ,
बायोकॉर्नेट है ना, देखना पड़ेगा, बिना देखे तो वो नहीं बोल सकते।
फिर मैं शतावरी घृत वगैरह उसका दे सकती हूँ, मैं
बिल्कुल
ट्राई
बिल्कुल
करती हूँ
निश्चित
क्या।
रिजल्ट मिलेगा। शतावरी घृति अपने पास ऐसा आता है, शतावरी और शतावरी घृत, बेदारी कंद भी आता है, बेदारी कंद भी अपने इस तरह से मसल रिलैक्सेशन का काम करता है, तो उसका प्रयोग अपने कर।
ठीक है सर, जरूर फॉलो करें, थैंक यू सर।
किसी और का क्वेश्चन अगर है तो अभी ले सकते हैं हम। डॉक्टर कृष्णा मेहर।
जी नमस्ते मैडम।
नमस्ते।
नो क्वेश्चन मैम।
नो क्वेश्चन। ओके, थैंक यू।
ओके।
क्वेश्चन नहीं है तो वाइंड अप कर सकते हम, है ना सर? पवन सर।
जी बहुत बहुत आभार आप सभी का। बहुत ही शानदार कार्यक्रम रहा, इंटरेक्टिव रहा, और मैं आशा करता हूँ सबके काम का है। अभी नेक्स्ट प्रोग्राम में मेरे 12 मिनट बाकी हैं, जब हम आयुष स्कोप एंड स्टेटस इन कनाडा, क्योंकि कनाडा डे अभी 1 तारीख को गया है, हम सेलिब्रेट करेंगे ठीक 10 बजे से। और दूसरा कल यूएसए डे है, यूएस इंडिपेंडेंस डे, तो कल हम यूएसए डे सेलिब्रेट करेंगे सेम टॉपिक के साथ। तो मैं आशा करता हूँ आप लोग जरूर जुड़िएगा, जरूर जुड़िएगा। थैंक यू। कामिनी जी, काइंडली कंक्लूड। कामिनी मैडम।
जी, बिल्कुल बिल्कुल। सो थैंक यू सो मच डॉक्टर रजनी। रामी सर, आपका भी बहुत बहुत धन्यवाद अपना ओपिनियन मंतव्य जोड़ने के लिए। और जो भी पार्टिसिपेंट्स जुड़े हुए हैं सबका बहुत बहुत धन्यवाद। जैसे कहा, सेशन वाज वेरी नाइस, प्रेजेंटेशन वाज वेरी नाइस, एंड डॉक्टर Rajni has prepared very good slides also. So thank you so much and congratulations to you also. So thank you all
Thank you,
the
ma'am. Thank
participants.
you, organizers, for this opportunity. Thank you.
Yeah, thank you so much.
थैंक यू, थैंक यू, गॉड ब्लेस यू, थैंक यू वेरी मच। After 10 minutes, same link and on Canada, status and scope of Ayush in Canada. वेलकम हरीश जी, वेलकम वेलकम।
जी सर, प्रणाम।
प्रणाम
नमस्कार।
प्रणाम प्रणाम। कैसे हैं?
बहुत बढ़िया जी, बहुत बढ़िया।
आप आ गए हैं तो मैं कार्यक्रम की शुरुआत करता हूँ।
जी सर, थैंक यू।
आपके यहाँ क्या टेम्परेचर है?
टेम्परेचर 30 के आसपास है जी, 30।
तो गर्म ही है।
जी जी जी, बिल्कुल।